Hi everyone, I'm Jerry Davison. I'm the Assistant Director at Able, South Carolina, and of course I got paired to go after the news anchor, so pardon my public speaking skills. So I'm going to tell you a little bit about us. These are our two main offices though. You'll see the Greenville one is located right on Pelham Road, kind of near the Haywood Mall. And something that I think is unique about our organization is that we really strive to practice independent living philosophy, and that is that people with disabilities all deserve the right to live as independently as possible. That doesn't necessarily mean in their own home without any support. It looks different for everybody, but that they have basic control over the choices in their lives. And you can see that to live, work, take part in the communities, and that they're the experts on their own needs. So we're called a Center for Independent Living, which is a little bit of a misnomer, I think, because people think we have housing for people to go live in, and that's not really the case. We consider ourselves more of a resource center, and we provide direct independent living skills, which I'll get into. We are community-based, which means that we go out and serve our consumers in the community. We know that transportation can be a barrier for people with disabilities, so we work in consumers' homes, in public libraries. They can come to our office if that's where they feel more comfortable. We do a lot of work in the school systems. We are cross-disability, so intellectual, spinal cord injury, physical, developmental, health conditions, learning disability, psychiatric, visual, hearing, you name it. As long as the person has a disability that they think impacts their day-to-day living, then they qualify for our services, and that is self-reported. We don't need any medical documentation, so it's a very, very easy screening process. We are a nonprofit. We don't make the big bucks. But the cool thing is that we are designed and operated by people with disabilities. Centers for Independent Living, there's at least one in every state. Our state actually has 3. Able, South Carolina is just one of them. But we're all set up with the same concept that people with disabilities have a unique relationship to go out in the community and encourage and motivate other people with disabilities to live more independently. These are kind of some of our mantra. Individuals with disabilities can make their own choices. They may need a more in-depth education. They may need it broken down in pros and cons or even pictures. But we believe they can make their own choices, that they can be held to the same expectations as those without disabilities, and that means having families, having jobs. And individuals with disabilities can succeed with self-created goals, and that's a big one for us as well, because people with disabilities often have goals made for them or goals set for them, and we think without that input, they're not that motivated to accomplish them. So, as I said, we practice what we preach. Our center is run by people with disabilities. We're required by federal law to have at least 51% of our staff and board members to have a disability. We're actually over 80% at this point with our staff. So these are some of my coworkers. This is Dory. She has a physical disability, so she uses a power chair, and she has a service animal who helps her do day-to-day tasks. Eric, who is blind, is an independent living specialist and a healthcare navigator. LaQuanda, who was in a fire when she was younger, has her hands amputated, a hearing disability, and a respiratory disability. And she's our lead independent living specialist, so she kind of shows us all how it's done. And then this is our executive director, Kimberly Tiso. Kimberly has one leg. So I think when people call us and say, well, I can't work, I have a disability, they're talking to the wrong people. So it's just really cool to see that interaction take place. These are the counties that we serve. We serve half the state. All of the upstate is included in that. Okay, I'm going to try to go through everything we do really quickly because I know I only have 15 minutes. We have an information and referral line, so anybody in the community, professionals, consumers, whoever, can call with a question. Where can I go for this? Where can I go to get a ramp built for my house? Does the ADA cover this? So Americans with Disabilities Act, sorry to throw around acronyms, but so anybody can call and get information. If we don't know the answer, we'll find someone who does. Independent living skills, that's our bread and butter. I'm going to get into that more specifically.
Jerry, you actually have plenty of time. You've got like 20 minutes.
So I can slow down with my spiel?
Take a breath, Jerry.
Okay, good, because I was like, how am I going to cram all this in? Okay. I'll probably still talk fast because it's just a habit.
No, you can just say more.
Okay. Peer support, that we consider peer support to be any time one of our independent living specialists work with a consumer because they are a peer to them. But also we have peer support groups that meet in our offices monthly. We have a youth peer support, and then we have an adult peer support. For those who can't make it to our office, we have an online peer support, and we can rent out webcams and headsets. So the only thing we can't provide is internet access. We do advocacy. That could be going to IEP meetings to help the student learn how to advocate for themselves. Not parents, we would refer out for that. But we go to employers when an employee has asked for an accommodation that hasn't been provided. We do try to work very collaboratively because we know when we leave, that person's still in that situation. I'm trying to think some more advocacy. Landlords, that's a big one for us as well. We also do a lot of systemic advocacy. We have an annual advocacy day at the State House where we work on major priorities that are barriers for people with disabilities: employment, housing, healthcare, and transportation were this year's focus. And so we're working on some of those systemically as well. Outreach and trainings, that's kind of what I'm doing here today, but we also do very specific disability etiquette and sensitivity trainings for any organization. We actually train all new vocational rehabilitation employees on disability sensitivity and etiquette, how to interact correctly with people with different types of disabilities, what the appropriate terminology to use is, some things about the Americans with Disabilities Act that they may not know that may be helpful for them in their work. We also do a lot of trainings for police departments so that they know what to do when they encounter a person with a disability who maybe has a speech disability that they can't understand, or a service animal. That's a big one. Youth services. Our youth programs are growing faster than we can keep up. We have a youth self-advocacy program. It's called EQUIP, and I think there are some brochures back there. If you know any young individuals ages 13 to I think 27, 28 that might be interested, we would love to have them join. We teach basic disability pride, communication, knowing what their rights are, how to self-advocate. And then if they're really passionate about it, then we even have spots where we can pay them, and that could be a part-time job for them. So it's some good employment experience for them as well. We also do youth services by going into the schools and teaching those same lessons in the school districts. We're involved with Cheryl in the Greenville County School District. We do some in Anderson and Spartanburg. I'm trying to think other upstate counties. Abbeville, if you consider that upstate. Health programs. We have healthcare navigation for individuals with disabilities who aren't sure about what their insurance options are, how Medicaid interacts with private insurance, whether they should sign up for the marketplace. That's a free service that we provide. We also go and teach steps to your health classes. So we teach individuals with disabilities healthy living choices, diet and exercise stuff. Adaptive exercise is a big one because a lot of people who use wheelchairs may have never been taught how to exercise in that wheelchair. Also, they may have never been weighed because a lot of doctors' offices do not have the appropriate equipment. We have a wheelchair accessible scale, so we're able to do that. So that's a really neat program that we have. Assistive technology, this is low-tech stuff like shower chairs, transfer benches, rollators, manual chairs, canes. If you know of anyone who needs those services, we have a contract with the South Carolina Assistive Technology Program. We can get those for free. There may be a waiting list if it's a high-demand item, but it's a really good program that we have going there. And I'm also going to talk a little bit more in depth about our employment services, so I'm going to save that one for later. Feel free to jump in and interrupt at any time. Our services are free. All of our services to consumers are always free. If we provide training to professionals, we do often charge for those. When we do assessments of facilities to see if they're ADA compliant, we charge for those, but never services for consumers. If a consumer wants to get connected with us, they can call us directly. You have the number on here, but there's also brochures at the back, and they just call and tell the person who answers the phone what they need, and that person knows how to handle that call. You as a service provider can also call, but eventually we're going to want to put that person on the line to make sure they want our services and so that they can answer some questions. If they have difficulty communicating over the phone, that's no problem. We'll set up an in-person appointment with them. I don't want that to be a barrier. Independent living skills training. This is kind of what we're known for, I guess, is anything that can make an individual become more independent, we pretty much cover. So even if you don't see it on this list, chances are we do that. This is a picture of Darius. He accomplished a lot of goals while he was with us. One was he wanted to move into his own apartment. This is him standing in front of me. apartment. He wanted to go from part-time to full-time, so he finally, with our independent living specialist help, worked up the courage to sit down with his employer and have that talk, and they were super excited about that. And then his other goal that he wanted to work on was budgeting. And so, because he couldn't figure out where his money was going. Well, you can look and see how well dressed he is. That's where most of his money was going, but they were able to figure that out and get him back on a budget. Down here is Dwight, and Dwight was living in a group home, and he wanted to move to his own apartment, but he needed to learn some skills on how to do that. So we went in and worked with him, and he learned how to cook some meals in a crock pot, and I think he even baked a cake for his family, but also he got organized in his home because in the group home everything's arranged and the staff know where everything is, but the folks living there don't often know that. And so we helped with kind of arranging stuff where he would know where everything was and labeling, and so he was a great success story for us as well. You can see the list, how we can go to the grocery store and go shopping with folks and let them know where things are. We can ride the bus with people so that they know how to use public transportation and learn the routes. We work on hygiene skills, so we can set a schedule for them, or we had one consumer who kept using the whole bottle of shampoo every time he took a shower, and so, trying different tactics with him, using, a capful or trial size bottles, different things until we found something that worked. A lot of things with preparing for college, filling out college application apps, Social Security applications, Medicaid applications, we can assist with all of that. You see some things like housekeeping on here as well. We do not come out and do these things. We teach the individual how to do these things. So sometimes that makes our consumers mad when they think we're going to come out and clean their house, and we get there and we kind of talk about, putting stuff in the baskets and organizing and kind of starting with the corner of the room. But I think once we explain our philosophy and that we know they're capable of doing those things, it changes their perspective. Our employment services, so we're a little bit different than a lot of employment providers in that we mostly are behind the scenes. Employers don't know that we're involved. We try and make that transaction as independent as possible. But these are some of the things we work on: reasonable accommodations, Title I options for employees, so we want to make sure they know what their rights are under the law so that they can advocate. We can help them draft letters requesting reasonable accommodations. Resume development, application and interviewing tips, we can do mock interviews with them. Job search assistance, and then connections with other community resources to help them out if they need some assistance, financial assistance. That's not something that we do, so we can connect them to a provider who maybe would be able to do that. This is Taylor. He has a disability that makes him extra social. He's always in a good mood. It's a very rare disability. He's always happy, but he always wants to talk. And so he was having some trouble finding a job because of that. So he volunteered with us for a while where the staff could kind of mentor him. And you see he got a job working at a semi-fast food restaurant, and he's great with customer service there. He kind of found his niche. And this is Grace. Grace is a cancer survivor, and she also has arthritis that has gotten worse over the years. So the job that she's always had became more difficult for her, and her employer wasn't really cooperating with accommodations. I think it was more they didn't really understand how to accommodate that. So we came in, met with them, helped her out. She's happy. She still has her job. So those are some things that we can help out with as far as employment services. We're also a Ticket to Work network, which means that we have this volunteer program that people can sign up for. We create a work plan with them, and the goal is that eventually they would become financially independent off of their Social Security benefits. And we can tell them all about work incentives and how to make that happen without losing that safety net in the process. It's great for us as well because we get a financial incentive from the government for making it work. Yes?
With that, do you help place them in jobs?
We still don't change our basic core services, so we won't do job placement. If that's something that the individual needs, then we would work with the organization that would possibly do job placement, like the Greenville DSM Board or South Carolina Vocational Rehabilitation. So we would still kind of keep the same type of employment services.
So it's more like case management?
It's more the behind-the-scenes soft skills work that we do with
Oh,
them. Mhm. So the resume writing and the cover letter, helping.
You're working
develop-
more with the individual rather than the company.
Right,
Yeah.
right. The company usually doesn't know we're involved unless they've done something wrong, and then we come in and
Yeah.
try to resolve that issue. This one's a very new one for us. In fact, we are still in the process of setting up for this because we just learned, I guess, a little over a week ago that we are now going to be contracted to do benefits counseling services, which means that we work one-on-one with individuals to learn how going back to work or increasing their workload will impact their benefits. Right now, we don't have anybody on staff that does this. I'm trained in it, but that's not my role, so don't call us for this just yet. We're working on hiring some folks right now, but this is the helpline, and this is where people need to go. For right now, they're going to be referred to our sister agency, Walton Options, until we're set up, but then we'll cover those upstate counties and actually a few more once we're set up to do that. If you have folks who are thinking about going back to work and receive SSI and SSDI benefits, they really need to sit down with someone. Vocational rehabilitation still provides the services. We didn't take this from them. They just only now provide it to folks who already qualify for their services. So that's kind of a difference in how it was before this happened. So now they'll be going to Walton Options instead of Voc Rehab if they're not already a VR client. So basic philosophy is through independent living skills, individuals with disabilities are able to become active members of society, contributing to their families and communities. We think community perception is so important in how much people with disabilities can achieve. We think that's the #1 barrier, more than architectural barriers like ramps and curb cuts. We think it's more important than program barriers. It's the attitude that we see in the community. And so we think if we all start coming together and having higher expectations for people with disabilities, then we'll see a difference in what people with disabilities are able to achieve. That was a whole lot, and I feel like I could pass out now. Any questions that you all have about our services, or anything that I might have left out?
There's a question.
Oh, yes.
I do. You said you do training with the police.
We're not connected with the Greenville Police Department, but we are connected with some police departments in other areas. We actually do monthly trainings for the Columbia Police Department, and we've done some.
And why not in Greenville?
Because they haven't reached out to us. At this point, because our services are kind of high in demand, we're not actively seeking that, but if we get connected, then we'll find a way to make it work. So we're not doing a whole lot of recruiting for that, but if you know someone that's interested in that, then you can connect them to us and we'll be happy to make it work. Again, that's a fee for service, so they'd have to be willing to make it work with their budget. But that's something that we absolutely think is necessary.
Okay, so under the advocacy, you do not, are not able to go to the police with things like they don't know that they should write a ticket for a handicap parking violation, and you can't address that with them?
What we would do if someone has had that happen to them, we would first try to work with that individual to make sure that they had done everything that they needed to do with that. And then if there's still issues with that, that's something that we could possibly look at to see if we could sit down. Yeah, so, and I know that you've been talking with someone from our organization, so if you want to, I don't know if they know that detail or not, but that's something that you can reach out to us about as well.
And I would recommend that the two of y'all connect when we close up shop here. Since you're
Well, my situation is that I have done that and gotten no result.
Yeah, and that's, police departments are hard.
Yeah, well, now I'm working with the sheriff's department. You think the police department is hard?
Whenever
We're an elected official department called the sheriff's department.
Whenever I do trainings there, I'm always get, I guess, a little dreadful before I go in there because they always have the most, they're very set in their ways a lot of times. And again, we've worked with great police officers, so I don't want to cast them all in the same light, but yes, they have.
But really, Jerry, your focus is helping individuals understand what their rights are.
Yes.
And being more assertive and advocating for themselves.
Right. Mainly the individual work and then the education piece.
Right.
The advocacy, the individual advocacy is usually, again, kind of a one-on-one type of situation. But yeah, most of our services are regulatory individual services. I have one in the,
If you're talking about the Greenville City Police, I met the police chief, he's very open working with people with
Yeah, he's
disabilities.
wonderful, and I got through to him, Chief
Okay.
Miller.
Yeah.
And now
That's a
the
good guy.
city police will write tickets for handicap parking violations, but the sheriff's office still
Oh,
won't do
okay.
it. So the deputies, and Greenville City can only do within the city
Yeah.
limits. They can't go into the county area, that's the deputies.
Right.
and there was some news coverage on that
Oh.
recently too, so the news station may be willing to talk to you as well on that.
How young do your services go? Is it high school?
There's actually no age minimum, but because we are consumer driven, we like for the consumer to at least be able to answer some basic questions about what they want. So we have worked with children as young as 6 in their IEP meetings to answer simple yes or no questions in their IEP meetings. Now they have to have some interest in that. We get a lot of parents calling, saying, yeah, let's get him to talk in his IEP meeting, but the consumer's not really there or interested because they know that's a requirement for us to be there and that's what their ultimate goal is. So, but we can go as young as 6, probably not much younger than that, but it would really be probably a mature 6-year-old who's,
Very mature.
yes, so. Well, we have some great independent living specialists who are good at motivating too, so that's interesting.
Do you have an age cap?
No, we serve a lot of the older population, particularly
The
through
geriatric.
assistive technology programs.
And we have an agreement with ABLSC that began last year, where they're now going into some of our middle schools, helping our middle school students with disabilities learn how to self-advocate, to make some decisions, and to empower them in their IEP meetings and just in basic, everyday choice making.
And we bring some of our youth from our youth program in as well, who have different types of disabilities, so that the youth can see, their selves in a few years. So that's a really cool experience. Yeah.
So you have the contract with assistive technology, and that's a lot of questions I get from families when I'm helping them. We're
Mhm.
needing some type of equipment. So I always have them go look at the exchange, but sometimes financial, they might not have the money. If we have them call you, since you have that contract.
If it's a low-tech item, then yes. The exchange is typically, for those of you who don't know, the South Carolina Assistive Technology Program has an exchange online where people can sell things or even donate things, and if there are items listed on there, then you can create an account and get connected with someone who's listed things. Everything from accessible vans to ramps to, there's all kinds of stuff on there. We're mostly getting the chairs, they're actually not that expensive for most, for most of us they wouldn't be that, but for a lot of our population they are a huge financial burden. So yes, if you're talking shower chairs and transfer benches and manual wheelchairs, those kind of things. A power chair, we can also do those, but they have to have the money to pay for the battery because there's a liability with South Carolina Assistive Technology Program.
Okay.
But that's still, $200 and something for a battery versus.
Back in the 80s, I'm going to show my age right now, but back in the 80s, there were a lot of labs around the country where you can go in and try different pointing devices and computer-based technology, more of the high-tech stuff. Do you know of anybody that still does that?
South Carolina
Oh, they
Assistive
do?
Technology
Okay.
Program does some of that too.
Where are they at? Are they
They're based in Columbia, but
Okay.
because we contract with them, if there was something that I don't want to speak for them, but I would think that we would be able to pick it up and bring it to Greenville for folks to try out.
Okay, excellent.
But yes, they do some of that stuff. And then there's Touch the Future that's in Anderson that does some computer equipment. I think it's purchasing. They refurbish
Yeah.
and provide it at
Okay.
a lower cost, but that's another resource.
Thank you.
What is the website for Salem Exchange?
It's like
SCATP.org maybe. It's SCATP is kind of the initials for it. So if you do South Carolina Assistive Technology, it's going to come up. They're a pretty big program. So if you
Okay.
Google that, it's gonna pop up with that website.
Any more questions for Jerry?
Just
Thank
how
you.
long can you hold your breath underwater?
Yeah.
I don't think you took 3 breaths that
I
whole
don't.
time.
This is what I'm known for. If you have any questions that you didn't get answered, feel free. There's a place you can click on our website that for general information. You can call one of our offices and ask as well. We'd love to partner with any of you guys if there's anything that you see a need for. As Mike knows, we kind of jump in and we're always willing to.
Well, no,